Hello and welcome to yet another episode of Doctors In. This is me, Anjali, here with you. Today we have a special guest. He is a specialist pediatrician and neonatologist. Let us welcome Dr. Musaddaq Inayat to the show. Welcome, Doctor.
Thank you.
First of all, we would like to know more about your early education and career life.
Okay, I did my MBBS from Pakistan, from King Edward Medical College. It's in Lahore. And then I had my training in pediatrics from New York. It's Lincoln Medical Center, affiliated with Cornell University in Bronx. And after that, I went from East Coast, went to the West Coast. In University of California, Irvine, I did my fellowship training for neonatology. So after that, I came here in Dubai.
Okay. So how and when did you find your interest in the area of neonatology?
Since actually from the med school, in Pakistan, neonatology is not that well developed. Pediatrics is, but so there's very high neonatal mortality rate also. So as I was more interested in pediatrics, I was seeing more and more. So I realized that neonatology is really the field which needs like more people to come and see. And then in US also, my mentors, which was like in my residency program, I really find good mentors for the neonatology. So I got more and more involved in this, had more research in this. So that's how eventually this interest came.
Okay. So coming to the topic, what are the problems that occur in newborns which requires intensive care support?
Newborns, if they are it depends on whether they are born preterm or full term. So full term, what we consider is any baby who is born more than 37 weeks is full term baby. Any baby who is born less than 37 weeks is considered as preterm baby. So most of the babies who are born preterm can have problems with the breathing. In the medical term, we call it respiratory distress or respiratory problems. And then the other most common problem is the feeding problem, when they have unable to feed, because usually the suck and swallow reflex, it develops at 32 to 33 weeks. So any baby who is born at 24, 25, 27 weeks is unable to take the feeding on its own. So he needs additional support. Same way the respiratory problems is the lungs gets mature usually at around 36, 37 weeks. So if the baby is born early, then the lungs are immature. There are some medicines now which gynecologists give to the mothers, which helps with the lung maturity as well as brain maturity and the kidneys maturity. So with that medicine, it helps a little bit, but still babies can face problem with the breathing when they are born, if they are born preterm.
Okay. And why does this happen?
The phases of the lung development, the lung, when is able to take any breath or start to have oxygen exchange, is usually at 24 weeks.
Okay.
So that's why the survival of babies less than 23 weeks is very, very rare.
Yes.
Okay. So the smallest baby ever survive is in Japan, which is 22 and a half weeks. But usually in the developed world, even like in US and Europe, babies don't have very good survival of less than 24 weeks. So that's and the reason is because the inside the lungs, whatever the lungs tubes are, they grow more and more after 24, 25 weeks, and they start to have the exchange of the oxygen and carbon dioxide at this age. That's why usually it happens. And the real maturity of the lungs come at 34, 35 weeks. And lungs continue to grow. Now we even know with different studies that lungs grow even up to teenage. So the growth process does not stop, but the earlier the baby is born, the more problem baby have with the breathing.
So how common or prevalent is this?
Respiratory distress syndrome in preterm babies is very common problem. It's the most common problem we see in the neonatal intensive care unit. And that's why we have different support system for the newborns. We can give them support from outside by putting something on the nose we call nasal cannula, and then there is an additional support we call CPAP, and then we can also support them by putting the tube inside and help with the breathing machine, that's ventilator. But we see it very often. It's very hard to say as percentage how many percent of babies. You see, it depends on the area and also depends on the babies who got whether steroids before birth or not. But I would say on average, any baby who is born less than 30 weeks, maybe 70 to 80% babies, you'll see respiratory distress of some kind. Whether they need too much support or little support, that's a different issue.
And why does this happen? Is it because of the lifestyle of the mother?
It has nothing to do with the lifestyle of the mother. Any problem which happens in the preterm babies has only to do with the prematurity. And prematurity is something which is mostly is not preventable. Most of our gynec and OB colleagues, they try to prolong pregnancies as much as possible, but some are the conditions where the delivery is, it has to happen, it's unavoidable. So in that condition, mothers should not blame themselves, because I see this a lot, because if the baby is born preterm and has to go through the NICU experience, mothers start blaming themselves, whether it's their fault or something. It's absolutely not mother's fault. Sometimes when the preterm delivery has to happen, it has to happen.
Okay. Could you tell us more in detail about feeding problems?
So feeding problem in the newborns depends on the whether baby is born preterm or full term. We see different kind of problems. So first I'll tell you the preterm babies. So in preterm babies, the most common feeding problem is that they cannot suck and swallow the milk or the breast milk right after the birth. That's one thing. The second thing is that if the baby is born really premature, like 27, 28 weeks, even 30, 31 weeks, 32 weeks, still they cannot take all the food right away on the first day. So that's why we gradually increase the feeding. Now it is recommended that if baby can tolerate, we start feeding as soon as possible. We used to not feed them in the past, like 10, 20 years ago. But now the more and more recommendations are coming that you start feeding as soon as possible if baby's medical condition is good and the doctor thinks it's okay. So that's like the most common feeding problems we see in the preterms. In the full-term babies, what I see mostly and from the mothers I get is that mother milk is not enough. Mothers complain that we don't have enough milk, our baby is not latching well. So these are the most common problems. Usually babies, full-term babies at birth, they have very good suck and swallow. They take milk very well. So what I advise to mothers is the more they will feed the baby, the more milk will come. And they should just have good diet and try to continue breastfeeding and should not attempt for the formula feeding. That's the best way to have success for the breastfeeding.
Why does these feeding problems happen or occur in the newborn?
So in preterm babies, the reason why it happens is because the suck and swallow reflex, like if you and me, when we drink water or milk or anything, first we suck and then swallow. But in the babies, this suck and swallow coordination develops after 32 weeks. So that's why even before 32 weeks, it's very hard or almost impossible for them to drink everything. That's the reason in the preterms. In the full-term babies, the more problem is with the coordination with the mother. And because a lot of times mothers have even the breast milk, but it's not coming out, or they are unable to express the milk. So that's why mostly it happens in the full-term babies.
Okay. What treatments are available for this?
So for the preterm babies, what we do is mostly we start feeding them first with the tube. We put a tube from the mouth or from the nose. It goes in the stomach and we feed through that tube. Slowly we increase the feeding and usually after 32, 33 weeks we assess whether the babies are able to take the suck and swallow reflex is developed and whether they are able to take the milk on their own, and then gradually we increase the amount of feeding. In the full-term babies, what we recommend to the mothers is, number one, they should feed more and more. Number two, they should avoid formula or the bottled milk. Number three, they can help massaging the breast, and they can do the expression of the milk with the use the breast pump, so that there is a flow of the milk from the breast. And they should not let the breast get engorged, like because that will also cause problem with the breastfeeding. So these things will help with the baby feed better.
What are the neurological concerns that occur in the newborns?
Okay, so for the preterm babies, the biggest fear is that these babies can have, if they are born really early, like 24, 25 weeks, and they can have bleeding in the brain. We call it intraventricular hemorrhage, which can have long-term effects on the baby's growth and the development. And also, if the babies are born preterm, their brain is also not developed. Just like their lungs, their brain is not developed enough. And so when they grow, the brain does grow with them, but eventually the preterm brain is a little different than the full-term brain. Most of the time, preterm babies, they do okay if they're born like more than 27, 28 weeks. But sometimes they can have some like motor delays and development problems, and even when they grow a little older, they may have some different behaviors than the full-term babies born at the same time. So these are the different concerns for the neurological point of view.
What treatment is available for the same?
Mostly there is what we call is an early intervention programs are available. So that's why it's very important when the baby is discharged from the NICU, should be seen by a neonatologist or by a pediatrician on a regular basis, and should have a development assessment done at regular intervals, so that if he has any development delay, it can be picked up and can be referred for the occupational therapist or speech therapist or physiotherapist accordingly.
Lastly, what message would you like to convey to our audience?
So the best message is that it's really recommended to have exclusive breastfeeding for all the newborns up to 6 months of age. And all the newborns, the only best food they can get is breast milk. I think that's the only best message I can give to all the audience.
Okay, thank you, doctor. Thank you for being a part of our show.
Thank you.
So that was Dr. Musaddaq with us. Until we meet next time, this is me, Anjali, signing off. Take care.